Isordil, also known as isosorbide dinitrate, is used to prevent chest pain, also known as angina, in patients with coronary artery disease. It belongs to a class of drugs called nitrates, which work by relaxing and widening blood vessels to allow blood to flow more easily to the heart. It's important to note that Isordil will not relieve chest pain once it occurs, and it should not be taken just before physical activities, like exercise or sexual activity, to prevent chest pain. In these situations, other medications may be necessary. Be sure to consult your doctor for more details. The daily dosage and optimal timing for taking Isordil will be determined by your doctor based on your individual condition and needs. So, when it comes to taking Isordil, it's important to follow your doctor's instructions. You'll usually take it 2 to 3 times a day, and it's best to take it at the same times each day. Don't change the dosing times unless your doctor tells you to. Make sure to use this medication regularly to get the most benefit from it. And don't suddenly stop taking it without talking to your doctor first. If you've been taking it for a while, it's possible that it might not work as well and you may need a different dose. Let your doctor know if you notice any changes in how well the medication is working for you. If you're taking Isordil, you may experience some side effects as your body gets used to the medication. These can include headaches, dizziness, lightheadedness, nausea, and flushing. It's important to tell your doctor or pharmacist if any of these effects persist or worsen. If you experience headaches, this may actually be a sign that the medication is working. Your doctor may recommend treating headaches with an over-the-counter pain reliever like acetaminophen or aspirin. If the headaches continue or become severe, be sure to inform your doctor promptly. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people who take Isordil do not experience serious side effects. However, it's crucial to contact your doctor right away if you experience any serious side effects such as fainting or a fast, irregular, or pounding heartbeat. While a serious allergic reaction to Isordil is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as a rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not mentioned here. If you are in the US, you can call your doctor for medical advice about side effects, or you may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before taking Isordil, make sure to inform your doctor or pharmacist about any allergies you may have to this medication or similar drugs. It's also important to discuss any inactive ingredients that may cause allergic reactions. If you have a medical history of recent head injury, anemia, low blood pressure, dehydration, or other heart problems, it's important to inform your doctor or pharmacist before using Isordil. Isordil may cause dizziness, and consuming alcohol or marijuana can increase this effect. It's important to avoid activities that require alertness until you can do them safely. Limiting alcoholic beverages and discussing marijuana use with your doctor is also important. Before undergoing any surgery, make sure to inform your doctor or dentist about all the medications and herbal products you are using. For older adults, there is a higher sensitivity to the side effects of Isordil, such as dizziness and lightheadedness, which may increase the risk of falls. If you are pregnant, Isordil should only be used if clearly needed, and the risks and benefits should be discussed with your doctor. It is also important to consult your doctor before breastfeeding, as it is unknown if this medication passes into breast milk. When taking Isordil, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. This means it's crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Isordil include drugs to treat erectile dysfunction or pulmonary hypertension, certain drugs to treat migraine headaches, riociguat and vericiguat. Additionally, Some products have ingredients that could worsen your heart failure, such as cough and cold products, diet aids, or NSAIDs like ibuprofen/naproxen. It's important to discuss with your pharmacist how to use these products safely while taking Isordil. It's also important to note that Isordil should not be used with medications containing isosorbide mononitrate. Lastly, Isordil may interfere with certain lab tests, such as blood cholesterol levels, potentially causing false test results. Make sure lab personnel and all your doctors are aware that you use this drug. If someone takes too much Isordil and experiences severe symptoms like passing out or difficulty breathing, it's important to call 911 or a poison control center right away. In the US, you can call 1-800-222-1222 for your local poison control center. In Canada, you can call a provincial poison control center. Symptoms of an Isordil overdose may include a slow heartbeat, changes in vision, severe nausea or vomiting, sweating, cold or clammy skin, and bluish fingers, toes, or lips. It's important to remember not to share Isordil with others. While taking this medication, it's crucial to have regular medical and lab tests done, such as blood pressure monitoring. Make sure to keep all your medical and lab appointments and consult your doctor for more details. In addition to taking Isordil, making lifestyle changes like adjusting your diet, exercising, and quitting smoking can help the medication work more effectively. Talk to your doctor or pharmacist about lifestyle changes that might benefit you. Remember to follow your doctor's instructions carefully for the best results. If you forget to take a dose of Isordil, take it as soon as you remember. If it's within 2 hours of your next dose, it's okay to skip the missed dose. Just take your next dose at the usual time. Don't take extra to make up for the missed dose. When it comes to storing Isordil, make sure to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom, and always keep it out of reach of children and pets. If you no longer need Isordil or it has expired, it's important to properly discard the medication. Do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.